Welcome to Business Connection. I'm Liz Spencer. We have a wonderful guest in studio. It's Bill Kottman. He's the president and CEO of Edward Hospital. Thanks for joining me.
Welcome. Thank you.
Now, it's been one full year as president and CEO of Edward Hospital. How's it been? Tell me a little bit about this year.
Well, it's been challenging. It's probably one of the more challenging times to be a hospital CEO, so my timing probably could not have been worse. But it's been exciting. And yeah, just a lot going on, both in the industry as overall and at Edward as well.
That's right. And now you've been here 20 years yourself.
Yep.
How's it been different to be in charge?
Well, obviously a lot more responsibility. Where before, I had my areas of responsibility and other problems I would be indirectly involved with, but now they're all mine, right? But I think it's just the approach that you have to take as a CEO, instead of getting mired down in the operational details. I see my job more as communication, making sure people understand some of the challenges we have and how we're going to respond to them, engaging people. We've got some tremendously bright people, and getting them involved in helping us actively come up with strategies to deal with the challenges that we face every day. And then really just, keeping the culture alive that Pam Davis was so successful in generating there in her reign. So if we can keep that legacy going, that'll be a real plus.
You had some big shoes or heels to fill.
Absolutely. Yeah.
Absolutely. Now, we hear a lot about Obamacare and whether to repeal or replace.
Right.
And in the news, how is that going to impact Edward and then ultimately us as your patients?
Sure. No one knows for sure what the model is going to come out like. I'm sure they will tweak it. I think to cut to the chase, and what we have been concerned with is what is the net effect of whatever model they come out with. And I think the net effect is a couple of things. Number one, providers are going to get paid less. Okay, meaning hospitals and doctors. We've already started to see that happen, and that will continue. And I think patients will pay more. One of the ironic things that has occurred with getting more people insured is that while it sounds good to have insurance, if you've got a $5,000 deductible, you're going to think twice about using it. And we see that a lot right now, where patients are foregoing care because they don't want to pay out of pocket. Because if you've got insurance and $5,000 deductible, it's out of pocket for those first $5,000. So, and that has seen other outcomes in terms of our bad debt going up and things like that. So I think we need a major overhaul of the system. I'm not sure. I know we're not going to see that in the next couple of years, but hopefully, sometime in my lifetime, maybe we'll see, our politicians really grab the challenge and have healthcare be, one program across the country and a universal plan.
Right. Well, and I kind of want them to take their time, because it's going to take some time to get it right.
Absolutely. It will. Right.
I feel like we rushed into our current system and now we're having to retool. So we need to take the time. Right. So let's talk a little bit about Edward Elmhurst. There was another announcement in the news of a $50 million reduction in cost.
Sure.
Where did that come from? What does that mean for us?
Yeah, I think it's connected to what we talked about earlier in terms of just with healthcare changes. And one of the phenomena that's going on is that we're seeing a lot more what we'd call government-based payers. So by that I mean Medicare and Medicaid. Prior to this last year, the combination of Medicare and Medicaid patients at Edward was under 50%. Now we're over 50%, okay? And those are not the best payers by a long shot. For example, Medicaid pays us probably about 6 cents on the dollar, doesn't even begin to cover costs. Medicare, maybe 25 cents on the dollar, and commercial, maybe about 40 cents on the dollar. And you used to be able to cover what Medicare and Medicaid wasn't able to cover in cost. You'd cover that with commercial, but now our commercial percentage is shrinking. And that's going to continue. The experts predict that probably within 10 years, most hospitals will have 70% of their patients will be either Medicare or Medicaid. So a lot of hospitals are not going to be able to survive. We've already seen an increase in bankruptcies at hospitals. So again, part of the larger problem of what are we going to do to fix this on an ongoing basis. What we're doing locally here, the $50 million cuts, is identifying areas where we can make cuts. It's not going to be easy, but we need to try to at least see if we can get to a break even under Medicare, and we have a long way to go. to get to that point.
Is that because of an aging population too?
Yep, aging population, and as well as, unfortunately, an increase in people that are going on Medicaid. Part of that, as I said earlier, is a good thing, that people that needed that insurance before didn't have it. Now they have it.
That's right. But there's still bright spots in Edward. And
there are.
You've got a lot of new things happening. Tell me about that.
The best bright part is our people. We have absolutely wonderful people, and I'm so thankful for that every day. But we continue to make changes. One of the other trends that's going on now is what we're calling the Amazoning of healthcare, Amazon effect, if you will. So we're getting very used to being able to go to our smartphones, order whatever we want, and have it delivered, within the next 2 days. How that's impacting healthcare is that you're going to see a lot more automation, a lot more things being done online. So we're doing things like online scheduling, being able to do price transparency, being able to figure out, how much a particular procedure is going to cost you before you come into the hospital. And then we're always building. So we just opened up a brand new neonatal intensive care unit, all private beds. We are adding 2 more ORs that will be coming online this fall. We just started work on a cardiac innovations and structural heart center that will be completed in about a year. We've got a new walk-in clinic. We have about a dozen of these out in the community right now. One just opened up in Donata, the Drew Lasco up there, and we've got a couple new MRI units. The MRIs. Their strength is calculated in terms of Teslas. So when they first started out, it was like a 0.75 Tesla, and then the gold standard became 1.5. Of late, 3.0 Tesla machines first came out in academic medical centers. We will have 2 of them here this fall.
So that's great. So there's positives and negatives with.
Oh, without a doubt.
I mean, more positives.
Yeah, we continue to move forward and with the latest and greatest, but we also have to keep an eye on the financials and get our financial house in order.
Well, I appreciate all that Edward does in the community, and even with the challenges, the quality and excellence is still there. So we so appreciate that. Thanks, Bill, for stopping by, giving us a little insight into what's going on over at Edward and in our changing medical fields.
Absolutely.
We'll be right back with more Business Connections. Stay tuned.